Good morning, everybody, and can I start off also just by acknowledging the traditional owners of the land, the Gadigal people of the Eora Nation, and thank them for their custodianship of land for 60,000 years. And of course now we're the beneficiaries of being able to have this meeting here today in these magnificent facilities. Can I also just thank Uncle Ray? Uncle Ray had to bolt, but I know Uncle Ray very well, as he was indicating. He and I have known each other for many years, and just thank him for his very warm welcome to country. And can I also acknowledge my ministerial colleague, Ken Wyatt, our federal colleague, and thank him for making the time to come over and to share in what is a very important summit. Stan Grant, heard Stan speak on a number of occasions, and it's always actually a great pleasure to hear Stan stand up and just advocate strongly for what we all need to be doing. My secretary, can I thank Elizabeth Koff for, even though I'm the political head, I want to thank her for her enthusiasm and energy on behalf of New South Wales Health for being so keen to work on the very big challenge, of trying to get better outcomes for Aboriginal people in regard to health. Can I also acknowledge, should I call him Scott Morrison? Scott Monahan. I actually think he looks good as a Scott Monahan. No, Scott Monahan as chair of the council, and also Steve from Casino, who's he's invited me up this morning to see the amazing work that he's doing up at Casino with his health service, Aboriginal Health Service. I understand some great dental work too, from what I understand, Steve. So I look forward to catching up with you. Somewhere in the room is the Chief Medical Officer, Kerry Chant, aren't you? Or have you? Ah, Kerry. So Kerry Chant, our Chief Medical Officer, and I'm looking around the room and seeing a number of our local health district CEOs, and I thank you for coming along, and of course all of the friends and colleagues who are so committed to making sure that we try and do more to improve Aboriginal health. You know, as you can tell from the grey hair, I've been around a while. And I had the pleasure of would have preferred to have been the minister, but I was the shadow minister for Aboriginal Affairs for about 11 years, quite some years ago. I kept putting my hand up and saying, I want this job. And in that course of time, I met an amazing array of Aboriginal people across New South Wales, indeed across Australia. And I think this summit just reminds me that it doesn't matter where you are in the hierarchy, you can make a difference if you have a voice and if you speak up. I have learnt lots from a lot of people at the very senior levels. People like Faith Bandler, some of you would know, an incredibly strong Aboriginal woman who spoke up for civil rights over many years. Evelyn Scott, the Belliers. Bob Bellier was our first Aboriginal judge, but more importantly, he was my sharer of notes while we were getting through law school together. And his notes were always better than mine, I have to say, which is probably why he ended up as a judge and I ended up as a politician, but still, that's all right. His family, his sister, of course, runs our Redfern Aboriginal Medical Service, and Sol sadly passed away just last year. But there have been an array of incredible leaders, but they're not necessarily those who we learn most from. We learn a lot from, but I think we learn a lot from people right down on the ground doing the hard yards as well, locally. Now, they did both, but there are people who are slogging away, making a difference. And I think of up at Burke, Alistair Ferguson, an amazing Aboriginal leader at a local level, trying to work out why it is that we spend so much money in so many ways, and yet we aren't making the difference that we should have made. Now, look, I am proud of the fact that there have been changes in the 20-odd years that I've been in public life, and it has been a non-partisan, non-political steps forward. I think both sides of politics here are committed, but find it difficult and find it challenging. I know everybody from Roger Cook in WA, the Labor Minister over there, the Labor Minister in Victoria, Jill Hennessy, my Liberal colleagues across the country, Ken, we're all trying. We're listening to the Alistair Fergusons and to the people at the coalface, but we're also listening to the others, and we're trying to make changes. And over the years there have been some modest improvements. but you've got to be kidding yourself if you think we still haven't got a lot more to do. And I think of some of the modest changes that have occurred here in New South Wales. I mean, I'm very proud of the fact that we have much higher immunisation rates amongst Aboriginal people, Aboriginal young people here than we do in the non-Indigenous population. We have lower mortality rates than we had for mums in childbirth going back in the last decade. It's certainly improved over the last 10 years. But there's so much that still has to be done. And my view, for what it's worth, is that it comes about because it's very challenging to address social disadvantage. Kerry Chant released a report yesterday here in New South Wales, our Chief Medical Officer, but one of those very important parts of health that you can't walk away from is the social disadvantage. Education, employment, lack of opportunity in employment, lack of completion of education, and we have to find ways to do that. I remember some of my greatest learnings have been, as I said, from people right on the coalface, on the ground. I remember walking into I can tell you which one it was Broken Hill Prison about 15 years ago when I was a shadow minister, and when I walked in I ended up talking to a gentleman who was in there for life. And we're standing in the middle of the yard there, an Aboriginal gentleman, and I said to him, what can we do to change the course of way things are happening? And he said, well, his view was, forget my generation, you've lost us. Look to the future generations. And he actually highlighted at that point youngsters in Wilcannia and Brewarrina sniffing petrol and so on. There is so much more that we should be able to do, so much more that we need to listen and learn. And I can assure you that from the New South Wales Government's point of view, and I believe every minister across the country, Labor or Liberal, we are here to support you in your endeavours. I'm delighted to welcome you all to Sydney and to say, I'm glad we've turned on the weather for you and it's not raining. And I look forward to hearing the deliberations of today, because this is yet another important building block in moving forward and making sure we really can make a difference. Welcome to Sydney and enjoy the day and the deliberations. Thanks very much.